Okay, so next up is Zoltan, please.
Yeah, good afternoon, dear colleagues. Thanks, Zoltan, for the opportunity to present the sustainability part. Although I'm representing the Irish Department of Health today. And we knew at the very beginning of the project, the joint action, that general principles will be applied. Central services, national infrastructures, regional infrastructure must be considered, and the hospital level infrastructure as well. And the guiding framework is the EIRA framework, so not just the EHDSI. Domain-specific interoperability framework, rather the complete European interoperability reference architecture. This was the other general principle. We used certainly data protection and data security, and we considered the methodology which must be used and can be used for the long-term sustainability and usage, and also for the governance. And we made some suggestions available in the documentation. I am going to provide a very high-level overview of the task completed. On the next slide, we refer to the building blocks of the joint European EHR system network. I highlight here that the overall objective is to ensure seamless data exchange, because we know that data is only available when it is moving. So the data must move, and this is the way how we are able to create value through data. And on the next slide, we summarize the overall approach. We considered not just the technical details, rather the social impact, and we considered the joint EHR system network as a data highway and data foundation for the European Health Union. And when we consider the large economic regions, Europe has certainly an advantage with the large scope availability of digitalized support and services. And this can be measured, this high volume availability and accessibility, by return on investment for the vendors, which is an important impact from the market perspective. And this was discussed during the project from healthcare systems and insurance quality. So quality adjusted life year is the important outcome which must be considered. And here we made our proposals in a structured manner, focusing on the MyHealth EU infrastructure, which is going to be extended. And when we gradually populate and accommodate the European health data space, we will experience that pan-European digital health service network will be available. So a pan-European system will be available for European citizens. And when we consider efficiency, it's worth considering central services. So one of the major outcomes of this work was the list of possible central services. These are available when we consider, for example, data recording, and when we consider data as a renewable resource and important resource of our time, the accurate data recording is key. And that data recording must be supported. And now we know that proper annotation services can ensure quality as well. AI supported services can be prepared. And when we consider the complete European health data space, it's worth considering to develop a central services, as we have the central translation services today. The data record support should be central as well when we consider efficiency. So this was the approach. we pursued and we made all these suggestions according to social impact and efficiency, and it will be worth considering all these components and develop all these central services. Thank you.